Hello everybody, Dr. Randy Wirtz in Thrive Chiropractic. Hey, I'm going to talk to you today about arm pain and really specifically getting down to carpal tunnel type issues. So arm pain can be a variety of reasons why we have it. Obviously there's a direct injury. In worst case scenarios it could be cancer, and usually that's a deep dull ache in the bone. But there could be also obviously if muscle strain, and you're going to know if you injure it. But what concerns me are the ones that you really just comes on like without notice or gradual, and you start noticing that. So obviously the cancer is what you want to look out for, bone cancer, because that would be a big surprise for a lot of people, and that's again usually a deep aching pain. But I'm talking about the pain that's like electrical, that runs down your arm. Specifically when you start moving your arm a certain way or your head a certain way, you'll feel pain going down your arm or coming down the front, or even with carpal tunnel, you'll feel it go throughout the palm of your hand. And that's what happens when we have nerve issues. And it's the nerves that are actually causing the pain, and it'll actually send pain signal down. Because a lot of times pain or arm pain actually starts in the neck. And what happens is you have to reach a certain threshold. So the nerve will be irritated in the neck as it leaves the spine, but then as it travels through, there's an opening between the rotator cuff, and it might be a little bit injured there, and then a little bit in your elbow, and then when it gets to the carpal tunnel, that's a problem. And let's face it, your wrist, very kind of unstable joint. Your wrist is held together by 8 bones, and it's held together by ligaments that are around this. So I would, if you can get a good picture, think of 8 marbles held together by rubber bands is what I would describe it as. Because any one of those bones can slip. If you're pushing off something, sprain it, land on it in a certain way, that can cause a problem. And you'll start to feel that there's 3 nerves that actually run up through your hand. One right here, and one along the side. And any one of those joints or bones that slip will start causing pressure on those nerves. It really starts to irritate, especially with moving around. There's some issues. So what do I look at as a chiropractor? First of all, I definitely look at any problems where you're having some pain. You know, if it's the elbow where you're feeling some pain starting here and going down in the hand, or pain starting in the wrist, or even pain coming in the shoulder will be the back of the shoulder. And it could be a result of degeneration in your shoulder, especially if you've had issues where you sleep above your hand, above your head, on your side, or people sleep on their side. That's an issue with the shoulder as well that can cause some problems in the back of the shoulder. So I start with the neck, then I look at the shoulder, look at the elbow, and then I work my way to the wrist, because any misalignments in those areas are going to affect the nerves and how your arm works. And you might not show up as pain right away. It might be tingling and numbness in part of your fingers, or it might just be that your arm is weak. And people are very surprised when I do tests in here, how I hold their hand up and their right hand goes down, and they think, my hand I'm right-handed, that should be stronger. But it obviously isn't the case, because those nerves are not communicating with those muscles the best they should, and that's a precursor to what we start to see numbness and then pain later on. So if you're a person that has this arm pain, or you might even have a person that you're worried about carpal tunnel and you think surgery is your only option, certainly not the case. There are many other options, and our chiropractic care with a chiropractic that does extremity work, definitely doable, that you can avoid a lot of issues, even with shoulder surgery or elbow or wrist surgery. You don't need it in some cases. Some cases you do, and it's great to have those surgeons that when you do need it, they can help. But my goodness, if you can avoid surgery at all costs, most people would want that. So understand, let's get this taken care of, that's you. If you do have any questions about this, please, you let me know. I'd be happy to help in any way, or even direct you to the person that I think would maybe best suit your needs. It might not be chiropractic, it might be some other place, but at least we know we go least invasive to most invasive. I want you to have a wonderful day. Take care, everybody. And if this was beneficial to you, it might be beneficial to somebody else, please pass it on. Thank you.